Hi, I'm Rich Ribeiro. The Terrell Fund is committed to educating the public about the need to support New Jersey's infants and toddlers right from the start. That's why we're proud to support the important early childhood programming produced by the Caucus Educational Corporation.
Funding for this edition of State of Affairs with Steve Adubato has been provided by the Terrell Fund, supporting right from the start NJ. Holy Name Medical Center. This place is different. NJM Insurance Group. Wells Fargo. New Jersey Resources. The New Jersey Education Association. And by Summit Medical Group, a multi-specialty medical practice providing comprehensive care from birth and pediatrics to geriatric care, concentrating in general wellness, cancer treatment, disease management, and behavioral health. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network. And by New Jersey Globe.
Welcome to State of Affairs. I'm Steve Adubato. I'm very proud to be coming to you. We are coming from the Agnes Varis NJTV studio in beautiful Brick City, Newark, New Jersey. It's our pleasure to introduce Ginger Gold Schnitzer, who is Executive Director of the Guarini Institute for Government and Leadership at St. Peter's University. Good to see you.
Good to see you, Steve.
I knew you when you were a kid.
I know, it feels like that, right?
Okay, so you've been with a couple of not-for-profits, advocacy organizations, right? 22 years at the NJEA?
22 years
the New
at the
Jersey
NJEA.
Education Association.
Absolutely.
So let me ask you this. I'm curious about this. You make the transition from lobbying and advocacy work for the New Jersey Education Association to a university setting. Yep. Ivory Tower or grounded in reality?
Grounded in reality.
Break it down.
Absolutely grounded in reality. Look, as I see it, our mission is to inspire the next generation of public servants, of policymakers, and of just informed citizens, right? Our democracy is counting on it. I have spent the last 25 years in Trenton working in legislative advocacy.
Education issues.
Education issues, and before that, a whole bunch of other issues.
Right.
But the point being, Steve, is that what I come to realize is that, you know, when I graduated, I thought that if you read the bill, you knew what to do. And then I thought if you build the relationships, you'll impact public policy. And then I thought if you organize, you'll impact public policy. And then I thought if we elect our own members or you elect your own people, you'll impact public policy. But at the end of the day, we need to better prepare humans to impact public policy. Where do you go to prepare humans? A university.
So let's play devil's advocate here. You know politics well, you know policy well. It took you a few years to start understanding how, I hate saying this expression, how the sausage is made, but that is part of it. But at the Guarini Institute, named after, by the way, former United States Congressman Frank Guarini, represented Hudson County, Jersey City area, just a class act. And he was very much a part of the St. Peter's University community. I'm going to ask you this. You have said something that I like to say a lot. Democracy is not a spectator sport. What do you mean by that? I know what I mean. What do you mean, more importantly?
I mean that if we don't engage, if we don't know the issues, if we don't take the time to share our opinions with the people making the decisions, it's like writing a blank check for anything to happen. And so part of that mission is to study policy and what's going on. Part of that mission is to figure out how to get it done, how it works and how to work it.
But who? The devil's advocate question really comes down to citizens. I mean, listen, we want citizens to be involved, but there are a whole bunch of folks watching saying, wait a minute, how am I supposed to be involved? That's why I elected him. That's why I elected her. That's what their job is. But that doesn't work.
No, you know what? If public policy is how we make the rules for our society, right? And who doesn't want to be at the table when the rules are being made? And there's lots of different ways you can take your seat at the table, right? Some people find it in elected office. You tried that for a while, right? But you found another seat at the table.
Did you have to bring that up?
Oh, I'm sorry. Come on, we just know each other a long time.
That's right. You were a young lobbyist down there when I was in my first term in the legislature in the mid-'80s. But the reality is I learned in that short period of time that you think you know how it works, but is it 3/4 of it relationships?
So look, it's real. A lot of it is about relationships, but you also have to understand the process. There's the process, what the textbook says, and there's how it really works. And before people can engage in this effectively, we need to share with them how it really works.
What about
Policy has a lot
students,
of
though?
constraints.
I'm sorry for interrupting.
No, go ahead.
You said that students, you're trying to prepare students for what?
I want to prepare students, if they're interested in a career in public policy, to pursue it. If they're interested to not have a career in public policy, I want them to understand that public policy, that policy making, that laws and regulations and the implementation of them affect their daily lives, and it's their responsibility to know it and to do something about it. That may be putting people in office who share their values. So it could be as simple as voting and being an informed voter. That could be as complex as, going to become the head of an agency or a department in state or national government.
In fact, there's we're taping this on the 9th, right, Patty? The 9th of April. So this may be seen after, on the 24th of April at St. Peter's University at the Guarini Institute, there is a policy policy discussion called In the Weeds. This is about the legalization of marijuana?
Absolutely.
Why would you start with that as your first forum?
Because it's the hottest issue in the legislature right now. And it's an ideal place to discuss it on a college campus where we have many students that may be really interested in that, right? And so it's if they're discussing it in Trenton, and if it's something that could happen in our state, and by the way, over 80% of our students at St. Peter's are from New Jersey, then we should be talking about it. We should be getting their feedback, their buy-in, their excitement for one side of the issue or the other, and try to show them that policy is really relevant to them. And by the way, I don't want to limit what Guarini Institute will do to just our students at St. Peter's University. We're going to hold programs that are free and open to the public. It's part of our mandate.
Even though it's a university, it's not just for students.
It's not just for students.
I'm going to expand the conversation. There's a good chance we're going to use this conversation for our think tank. Check out our website. We have a new series called Think Tank. There's a podcast that goes with it. And when we discuss some things that have national implications, we've included it. And I'll tell you why I'm asking this. I'm obsessed by, hopefully in a healthy way, the tone and tenor, the negative, nasty, ugly tone and tenor of political discourse in our nation. Are you?
I am, and that's one of the things I said when I said we need to find a place to create better humans or better prepare humans for this work. Better preparing humans for this work might entail, how do we get this done without some of that?
Could you see what goes on in Washington every day? We see Trenton's not as bad.
Trenton's not as bad.
But let's do Washington for a second.
Sure.
The name calling, the pettiness, I'm not going to have you're not getting that gateway tunnel until I get my wall. And it's not just about Donald Trump. Democrats are just as guilty as anyone else. You're an optimist by nature, but do you see the leadership because you have a leadership, an institute about government and leadership, do you see the political leadership to do that in Washington right now?
Look, I think that political leadership, no matter where you are in your leadership, you have potential. And I believe with the right civic engagement and pressure on our leaders, when we reject that as an appropriate discourse, then we do have the power to change it.
You mean that people need to demand better from those in leadership positions?
And people need to not respond to negative stuff.
Because some people say, I like that. I like when people are say what they think. But hold on, but what about if they think? Because you're calling someone a name. What does that have to do with policy?
Or worse, if you're making somebody in this country feel marginalized by their race or their religion or, right?
Yeah, by the way, I'm curious about this. Future forums that the Guarini Institute are going to have. I know there's one you're going to do on healthcare, another one on economic development, budget and taxes. Immigration in the mix or no?
Sure. Our students are very interested.
Diverse, sorry for interrupting. A very diverse population.
Yes. And frankly, I've been going to political science classes in the last week and talking about the Guarini Institute. And I always ask students when I go there, I say, tell me what you're passionate about. And immigration's come up a lot. And then I ask them, this follow-up question is, okay, you told me what you're passionate about. Now, what are you doing about it?
And what do they want to see done?
Right. Well, I want to know what they're doing about it, because the Guarini Institute, I like to think that we're going to be about putting your passion into action.
As opposed to like we just talked about it? That's not enough, that we talk?
Look, talking is a very important part, right? The conversations you always hear around election time that there's nothing more influential than the conversations we have around the dinner table. So let's raise the quality of those conversations.
That's right. And if it doesn't start there, then why would we expect it to start in Trenton or Washington or anywhere else? Ginger Gold Schnitzer, is Executive Director of the Guarini Institute for Government and Leadership at St. Peter's University. They're, in fact, one of the supporters of what we do here at the Caucus Educational Corporation. We wish you nothing but the best. 22 years at the NJEA, now switching over to higher ed. We wish you all the best.
Thanks, Steve.
Okay.
Thanks for
Stay
having
right
me.
there. I'm Steve Adubato. This is State of Affairs, and we will be right back.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs is pleased to welcome Peter Chen, Policy Counsel for an organization called Advocates for Children of New Jersey, advocating for the children of New Jersey every day. This is part of our ongoing conversation, part of our series called Right from the Start NJ, 0 to 3, prenatal care as well. Peter, we work with your organization on a lot of issues, try to understand the impact, particularly for poor children or children in inner city disadvantaged areas. Right. You've said that the 2010 census that the federal government runs has undercounted, misrepresented the number of children in inner city areas, Newark, Jersey City, other places, and it's devastating. Talk about it.
So the census determines funding for a wide range of
federal funding.
That's right. But many state programs also are based on census counts. So the federal count of the total number of residents in different areas determines funding for things like schools, Head Start, child care, health care, Medicaid. So huge programs, and basically every federal program that you can think of that benefits low-income children and families depends on census counts in order to determine the funding. And when children are not counted, as happened in 2010, the amount of funding is lower than it needs to be for the total population that
Peter Chen, why weren't these children counted?
Well, many children live in what are called hard-to-count areas, areas where it might be harder to count people because it's a low-income area, people may not speak English, or simply because there are multiple residences in one location. So if it's a rental property, if it's an apartment building, or if there are multiple rental units all in the same house. Those may be areas where the mailer that goes out might not be counted. But one of the big factors for why children are undercounted, and particularly very young children, is because the family or the householder omits them from the form. Okay, they just leave them off the form. And it's not because necessarily they don't know that the child lives there, but that children may not be included they may not be considered like a person that needs to be counted on the census.
But that's a misconception of how the census works. And why is it disproportionately in urban areas like Jersey City and Newark?
Well, so there are a few factors that have been shown to be linked with leaving kids off the census. Those are living in a racial or ethnic minority household, living in a household where no adult speaks English very well, living in a household that has a grandparent householder, or living in a household where there are unrelated people living in the home. So you might have two families that are unrelated that live together in one address. And in that case, what might happen is one family might fill it out, and the other family might not be included when that person fills it out and might not know that they were supposed to be included.
But Peter, this also, by the way, speaking of Peter Chen from Advocates for Children of New Jersey, you're going to see our website from Right from the Start NJ. Check it out and all kinds of important information. It's been 2 years we've been doing this initiative, and when we started it, frankly, Peter and everyone listening and watching right now, we had no idea how many challenges that infants and toddlers have and those who care for them have. In this regard, I'm curious about something. What does this have to do with political representation, the undercount of the census in 2010?
So there are two pieces in the upcoming 2020 census that are going to be really important for New Jersey for political representation. The first is that the total number of residents in the state determines how many congressional representatives New Jersey has.
We have lost seats.
We have lost seats. In 1990 and in 2010, we lost a congressional seat. And so that means less voice in D.C. It also means less voice in the Electoral College for presidential elections.
We have 13?
We have 12 now.
12. We had 14.
Yes.
And each time you lose a certain amount of people compared to the rest of the nation, the static number in the House of Representatives must remain at 435 members. So if Texas, if California, if New Mexico, if those other states gain more in the census, they get more political representation. New Jersey loses congressional representation. Is that a fair assessment?
Yeah, and the only thing I would clarify...
Because the number 435 doesn't change.
Right. The only thing I would clarify is that New Jersey doesn't even have to lose population. It's only that New Jersey has to grow slower than the other states.
So the population of the nation is growing. If we have less of a percentage of the people in our state compared to the rest of the nation, we lose.
Right. That's right.
And what does that have to do with kids?
So obviously, children depend on their elected representation. Kids depend on their elected representatives.
Those who are supposed to care about them.
That's right.
In political office.
That's right. And so we see in when congressional representatives are going up to bat for kids for Medicaid funding, for CHIP funding, for school funding.
CHIP is?
The Children's Health Insurance Program.
Right, right.
We need more of them in order to go to bat for kids' programs. And the other piece that's going to be really important is redistricting. We hear a lot about gerrymandering or the borders of political districts, and that's all based on census counts.
Wow.
And so if particularly low-income areas have undercounted populations, that means they get less representation in New Jersey's State House as well, not just at the federal
Before
level.
I let you go, Peter, the minute left, the issue of planning. What does the undercount in the census of children have to do with planning? Planning what?
So if a hospital is thinking about where they're going to build a new branch, or a school district is trying to determine if they're going to expand to a new location, or if the planning board is trying to figure out what road is going to be put down to a new subdivision, census counts all go into the calculations of where that's going. So whether it's a business, whether it's government, those plans all depend on the number of people that are there.
So real quick before I let you go, the advice for everyone watching right now in terms of being a part of this 2020 census in a meaningful way.
So the biggest thing is to just get educated about the census. The state of New Jersey has a census website. ACNJ is putting together a census website, and the Census
Advocates
Bureau.
for Children of New Jersey, your site has been up. So if they go to your site, what do they find out about the census?
So there's a whole list of different resources that are available, both sort of like a Census 101, as well as PowerPoint presentations, PDFs, all kinds of information for people to use on why the census is so important for kids.
Peter Chen, Policy Council Advocates for Children of New Jersey. This is part of our Right from the Start NJ initiative. Peter, I want to thank you for joining us. Well done.
Great. Thanks,
Stay right
Steve.
there. This is Steve Adubato. This is State of Affairs. This is the Agnes Varis NJTV studio in Newark. We'll be right back after this.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
State of Affairs welcomes Stephanie Hunsinger, who is State Director, AARP, which stands for?
Well, it used to stand for the American Association of Retired People.
After
but
the rebranding.
It's just AARP.
I love it. People know what it is.
Yeah.
Listen, I got
You got your card?
Yeah, thank you very much.
Yeah.
Don't
You
make
should be proud.
Yeah, well, half. So, but I'm proud of the work you and your organization do.
Yes.
Let's do this. Let's jump into a few issues. The population you represent, talk about them.
So we represent the 50 plus across the country, just over 38 million members across the United States. In New Jersey, we have 1.3 million members, but as our motto says, what we do for all. So we really represent the entire 50 plus population. But we also know that what we're doing for the 50 plus today is beneficial and will affect generations to come. So we really do believe that what we do is for all.
Let's break down some issues you and I were talking about right before we got on the air. If the Affordable Care Act is in fact repealed, I mean, listen, there's been so many attempts. If it were to happen, Obamacare, what do you think it would mean for the population you represent, your members?
It would be terrible for the population that we represent. You know, AARP supports the critical aspects of the Affordable Care Act that are really important health priorities for Americans that are 50 plus. So things like providing access to affordable quality coverage, discrimination based on age and pre-existing conditions. That's a huge issue for our members. You know, as individuals get older, they could be charged more. The provisions in the ACA, so right now there's a rate of about 1 to 3, and as you age, you can be charged higher. As you get older, you may have more illnesses, chronic illnesses, so insurance companies are higher risk, so they'll charge more for an aging population. ACA keeps that at a reasonable level without the provisions through the ACA, that can change.
But Stephanie, the Governor Murphy is saying in New Jersey, hey, listen, we'll take care of it. We'll set up our own exchange. We'll be good. You say?
So New Jersey has some really great laws currently that protect individuals from age discrimination, pre-existing condition clauses, providing affordable coverage.
Is it enough?
It's enough for
If
individuals
it were to
that
be,
have...
sorry for interrupting.
Yeah.
If the ACA were to be repealed, is what New Jersey doing enough?
A lot of what New Jersey has in place is covered through the ACA. Could we do more? I'm sure we could. We always could do better in really providing affordable access to individuals. More importantly, how can we work to lower prescription costs?
Yeah, can we talk about that? How
Yeah.
bad is, how serious a problem is prescription drug costs for your members?
It's a problem. On average, individuals who are on Medicare over the age of 65 take around 4.5 different medications on a monthly basis. They are extraordinarily expensive.
Yes.
People are in positions where they're choosing between taking the medication that they need to stay healthy and buying their groceries or paying their electric bill or paying rent or mortgage. No one should ever be in that position. Our costs are exorbitant. And we need to do something to change that. We need to do that. Congress needs to do something to change that.
Who's the leader on this? I heard Senator Booker and Senator Menendez talking about it. Are
Yeah.
they leaders in this effort?
They're champions on this, and we'll continue to work with them and trying to get them to push this and do everything that they can to help lowering the costs.
Do you think the industry, the pharmaceutical industry, as a group, are listening and understanding how serious this problem is for those who are 50 plus?
I think they're listening. I'm not sure if they're understanding it. So our job is to make sure that we keep getting that message out there and making sure that everybody understands that, not just Congress, not just constituents, but the pharmaceutical companies as well. And we're not asking them to change the work that we're doing, not asking them to decrease research. What we're asking them to do is think about where they're spending their money and pass some cost savings on to consumers. Americans pay more for the prescription drug coverage and costs than pretty much any other European country does. And that's a problem.
We're number one, and that's not good.
It's not good.
Can we talk about this initiative? I'm curious about this. The New Jersey Secure Choice Savings Program passed March 28, 2019. What is it?
Yeah. So it is a private-public partnership where it provides a vehicle for individuals. 53% of New Jersey residents had no way to save for retirement through their employer. And so this sets up a private-public partnership where workers who didn't have access to saving for retirement now can. It is a auto deduction. So instead of
What does that
opting...
mean?
So instead, normally you would opt in to a 401k
Okay.
at your employer. This isn't automatic, so you have to opt out of participating. So when you start working for that employer and you sign up to be a part of this program, you will automatically have a percentage of your salary that will be put into a savings retirement plan for you.
You know, some of us are obsessed by trying to save for our kids to go to school.
Yeah. Yeah.
Hard to do. But what about the whole question of saving for retirement?
Yeah, so, you know, right now, on average, the average American has about $14,500 saved for retirement. $14,500.
That's the average.
That's the average. In New Jersey, the average Social Security check that residents receive is around $19,000. So people are relying solely on Social Security.
$19,000?
$19,000 a year. A year they're getting, $19,000 a year. And people are relying solely on their Social Security as their retirement, and that is not what Social Security was meant to be.
So what do you say to your members? What do you say
sorry?
to them? What's the message to your members about this?
The
Because they're
message
trying to
is-
get through every month,
Yeah.
but they got to think about the future.
So Assemblyman Freeman was a sponsor of this legislation, and recently at the bill signing, he made this analogy, and I thought it was such a great analogy. He said he remembered when he was a kid, his dad would come home and he'd have change in his pocket, and he would take his change out and he would put in like a jar or in
Sure.
a bucket in their house. You know, after a while, that little bit of change, you don't even realize it's missing, but after a while, it all adds up. And this is what the Secure Choice Savings Program is about. It's about taking a little bit now and putting it away without even realizing that it's gone. And then in time, that adds up so that you end up being in a position where you can live comfortably in retirement. You can stay in your home and in your community and with your family where you want to be and not be in a position where you're forced to have to relocate because you can't afford to stay where you are.
Before I let you go, this is Stephanie Hunsinger, who is State Director of AARP New Jersey. Social Security. How secure?
I think that it's going to be a fight, and we're going to continue to have to fight to protect Social Security. It may not be the only means of savings, but it is an important means of savings for, as I just said, many Americans who are relying solely on that for their retirement. We have to do everything we can to protect that and make sure that it's there. They've been working for years and paying into the system with the idea that it's going to be there for them when they need it, and we need to ensure that it is.
And anyone says we need to balance the budget by making some cuts on Social Security, raising this age, that you say?
I say no. Making cuts to those changes ends up not only hurting the individual, but it hurts us as a country as well. It ends up costing more money in the long run. It's the same thing with the ACA. When you provide individuals with assistance that they need, Social Security, adequate, affordable health coverage, you don't have individuals who are running to the emergency room. You don't have individuals that are coming to the government to ask for assistance.
Stephanie, it's the first time you join us. Don't let it be the last.
I hope not. Thanks for having me.
Thanks for being here. I'm Steve Adubato. Thanks for watching this edition of State of Affairs. So let's continue the conversation. So follow me on Twitter at Steve Adubato. Promise I'll see you next time. Take care.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by the Turl Fund, supporting Right from the Start NJ. Holy Name Medical Center. This place is different. NJM Insurance Group. Wells Fargo. New Jersey Resources. The New Jersey Education Association. And by Summit Medical Group.
Holy Name Medical Center is leading the statewide effort to improve end-of-life care through the use of advanced directives, recognizing a person's wishes on how they want to spend their last chapter of life isn't about death, it's about living. Our goal is to help all patients maximize their quality of life in their final months, weeks, days, and hours.